Okay, we're doing Chapter 6, review. Before beginning personal care, nursing assistants should explain to residents exactly what they will be doing. True or false?
True.
When skin begins to break down, it first turns black.
False.
False. All other colors but black. Purple, blue, white, red. Because pressure sores can lead to life-threatening infections, prevention is very important.
True.
Bathing provides an opportunity to observe a resident's skin.
True.
When a resident has white, red, or purple areas on the skin, it is important to massage them often.
True.
When they have the white, red, or purple areas, it is important to massage them area, not the areas. You're around the area, so that would be false. Nursing assistants should use bath oils when giving tub baths. Nursing assistants should cut residents' toenails. Gloves do not need to be worn when shaving. Men generally use a urinal for urination. Oral care includes brushing the tongue. Nursing assistants should use hot water when rinsing dentures. And we didn't mention that, but it's warm water, warm tap. They don't want to warp them. To prevent aspiration, nursing assistants should use as much liquid as possible when giving mouth care to unconscious residents. Other terms for weaker side are involved or affected. A standard bedpan should be positioned so that the wider end is aligned with the resident's buttocks. True. We really didn't talk about that, so y'all do good. Urine and feces are irritating to the skin and should be washed off completely. Areas of the body where the bone lies close to the skin are at much greater risk for skin breakdown and pressure sores. Nursing assistants should pull residents across sheets during transfers. After a resident has been placed in a wheelchair, the nurse assistant does not need to reposition him or her every hour. Bed cradles help keep bed covers from resting on a person's feet. And we actually learned that in a whole nother chapter. But that's that bed cradle, the thing that goes over them so the covers don't touch their feet. If a resident starts to fall, the nurse assistant should try to reverse or stop the fall. False. We're going to allow them to, we're going to assist them to the floor. We're going to break their fall, but we don't stop their fall. We are assisting them to the floor. We are helping them. Sounds like it, but in a wordage, you're not going to stop them, because if you stop them, that's that whiplash. You don't do that. You don't stop a fall, because that's going to hurt you bad. Yeah. Back rubs can increase circulation. An orthotic device helps support and align a limb and improve its functioning. When cleaning a female's perineal area, the nurse assistant should work from front to back. Which of the following statements is true of helping a resident dress? The nurse assistant should allow the resident to choose his own clothing. True. The genital area and the anal area is called what? Perineum. Perineum. When a resident is falling, the nurse assistant should catch the falling resident, try to stop the fall, get the resident up after the fall, gently lower the resident to the floor. When a person is lying on his left side with one leg drawn up, he is in the blank position. One leg drawn up. Sims. When a resident is lying on either side. Lateral. When a resident is lying flat on his back, looking up. When they're laying on their stomach, about to suffocate, prone to suffocate. When a resident is in semi-sitting position. That's the other, that man. That owns this building, kind of. Mr. Who? Fowler's. Flowers. But Mr. Flowers owns the building. Chapter 7. Residents have a legal right to be notified of a room or roommate change. Axillary is another word for armpit. Normal body temperature is 98.6 degrees Fahrenheit. The most common site for checking the pulse is on top of the foot. Where is it? During the systolic phase, the heart relaxes. Systolic is on top, diastolic is on bottom. Remember that diastolic means dying down. So during the systolic phase, the heart relaxes. False. What the heart relaxes in the diastolic. Blood pressure is recorded in a fraction.
True.
Residents in wheelchairs will be unable to be weighed. False. There are many negative effects from restraint use. When a resident is restrained, he must be checked at least every 15 minutes. True. Did we talk about that? No. How did y'all know that?
Yeah.
That's right. But in restraints, they have to be checked every 15 minutes. A catheter drainage bag must always be kept lower than the hips or bladder. True. Late at night is the best time to collect a sputum specimen. False. Early in the morning. Oxygen can easily explode or catch fire. Nursing assistants will be responsible for inserting IV lines. A closed bed is a bed completely made with the bedspread and blankets in place. Non-sterile dressings are usually applied to dry wounds that have less chance of infection. When taking a rectal temperature, you do not hold on to the thermometer. False. Your body actually will just push it right on out. It just kind of this don't belong in here, and it'll ease right on out and pop out. That's why you're holding on to it. Barriers to managing pain include the feeling that pain is a normal part of aging. Is that a barrier? If you think that pain is normal, is that a barrier for us to come treat that pain? It is. If you think it's normal, then you're not even going to ask for any medication. So barriers to, listen, it's a trick word. Word's funny. Barriers to managing pain include the feeling that pain is a normal part of aging. True or false?
Wait, what you?
Barriers to managing pain include the feeling that pain is a normal part of aging.
That's true.
True. That is a barrier. Because somebody thinks it's normal. So we can't treat it. If you don't ask for help, you think you're supposed to be in pain, we can't treat you right because you're not going to tell us because that's normal. So that's a barrier. But you should not be in pain. We're going to try to help you get out of pain. The nurse assistant should ask questions to get the most accurate information on the resident's pain. Yes, and they make us ask about 1,000 questions. During care of a resident's unit, the nurse assistant should restock supplies. True. Any supplies, especially if you know there ain't but 2 pairs of gloves left, get some more. Don't wait until they're all gone. Or don't wait until you get the last one. And you might be the one that needs one more set of gloves. And you are in trouble. So make sure everything's stocked up. Toilet paper, things they need. Bedpans should be stored on the top of an overbed table. False. Which temperature site is generally considered the most accurate? Rectal, anal, go together. When may a resident be applied? A restraint be applied? Only with a doctor's order. A 5-ounce glass of juice equals what? 5 times what? 30. 5 times 30. 1 ounce is